Hello everyone, welcome back to Daily Essay Drop, and today we are going to be discussing one of the most important essay topics in physiology, which is shock. So we'll move on. So the contents usually in when questions for shock are asked, it comes under the following headings: under definition, classification, physiologic basis, stages, and treatment. So we'll go into the definition. So shock is actually a syndrome characterized by inadequate tissue perfusion with relatively or absolutely inadequate cardiac output, thereby depriving tissues of oxygen and nutrients. So, the main points that should be there in your definition is that there's cellular hypoxia, there is inadequate cardiac output, and inadequate tissue perfusion. Okay, these are the keywords you should include in your definition. Next, the classification of shock. So, classification of shock is that it is divided into hypovolemic shock, distributive shock, cardiogenic shock, and obstructive shock. Okay, so it is divided into four. Okay, now we'll move on to hypovolemic shock. So, hypovolemic shock, by the word hypovolemia, which means there is loss of blood volume. So, the main point here, there is loss of blood volume, and it is also called as cold shock, about which we will discuss later. Now, the causes. What causes a reduction in the blood volume? Hemorrhage can cause burns, trauma, and any fluid loss like vomiting and diarrhea. So, the basic point in hypovolemic shock is there is a loss of blood volume or there is low blood volume, and this results in decreased cardiac output. So, there is decreased blood volume. That is the main point. Okay, there is a decrease in blood volume. It can be inferred from the name itself. Next, let's go to distributive shock. Distributive shock is also called as vasogenic or or low resistance shock. Low resistance shock. So, vasogenic, which means something related to the blood vessels. So, there is marked vasodilation. Marked vasodilation. But here, the blood volume is normal. So, in spite of normal blood volume, there is shock. So, why is that so? It's because of marked vasodilation. So, the diameter of the vessel increases, the capacity of the circulation increases. And what causes the vasodilation is that there can be neural reflexes or toxic substances which causes vasodilation. So, now the causes of distributive shock is divided into three, and based on the causes, distributive shock is actually divided into three, which is neurogenic shock, anaphylactic shock, and septic shock. So, in neurogenic shock, what happens in neurogenic shock? There is an increase in vagal tone or a decrease in sympathetic vasomotor tone, and this causes vasovagal syncope, and this can result in fainting, and that is because there is peripheral pooling of blood. Okay, there is pooling of blood in the extremities. Now, in anaphylactic shock, anaphylaxis, which means there is some kind of allergic reaction, and in an allergic reaction there is release of histamine or histamine like substances. Now, what does histamine cause? Histamine can cause vasodilation, as well as it can increase capillary permeability. Okay, so when there is an increase in capillary permeability, there is fluid loss, and because of this fluid loss there is hypovolemia also. So, for anaphylactic shock there is also a hypovolemic component. Okay, now in septic shock, it is caused due to gram negative bacteria, and these gram negative bacteria release endotoxin, and the release of endotoxin again it causes vasodilation and increased permeability. Okay, and so therefore septic shock also has a component of hypovolemic shock, and this finally ends up in multiple organ failure. Okay, so I hope you understood what is distributive shock. Basic point, it's vasogenic, and because it's vasogenic, which means marked vasodilation, and marked vasodilation is due to neural reflex or toxic substance, divided into three: neurogenic, anaphylactic, septic. Okay, anaphylactic main point, histamine release causes vasodilation and increased permeability. Septic, endotoxin causes vasodilation, increased permeability, and neurogenic, there is vasovagal syncope which results in fainting because of increased vagal tone. One point here is to note here is it is also called as warm shock. We called hypovolemic shock as cold shock and distributive shock as warm shock because the skin is warm. Okay, hope you understood that. Okay, now next comes to cardiogenic shock. So in cardiogenic shock, cardio, which means something related to the heart. So there is decrease in pumping ability of the heart. So the pumping ability of the heart is compromised. And because there's a decreased pumping ability, obviously the cardiac output will decrease. And also the blood flow to the tissues is not enough to even meet the resting demands. Okay. It is also called congested shock. It is also called as congested shock. Now what are the causes? Myocardial infarction, arrhythmias, heart failure. Okay, hope this is clear. It's very simple. Okay, now we come to obstructive shock. In obstructive shock, it's actually an extra cardiac. We should call it extra cardiac obstructive shock. So what is the main point here? Due to an external pressure, there's some kind of external pressure, and because of this external pressure, there's an impairment in ventricular filling. So there is a problem in ventricular filling. Okay, so because of an external pressure during diastole, there is decreased ventricular filling, and because of which there is decrease in cardiac output. So the causes are cardiac tamponade, tension pneumothorax. These are the two examples that you have to thorax. Okay, these are the two examples you have to learn. So if just to explain cardiac tamponade, here there is a pericardial bleeding. So if this is, I'm just drawing a rough diagram here. So if this is your heart and this is the pericardium, this area is the pericardium. Because of increased bleeding in this region, there is an external pressure to pump blood from the heart. Okay, hope you understood the point. Okay, next we come to the physiological basis. This is the most important part of shock, wherein the physiological basis of each and every symptom. So we'll mainly be focusing on hypovolemic shock. So the features of hypovolemic shock. What are the features of hypovolemic shock? Rapid thready pulse, cold pale clammy skin, intense thirst, rapid respiration, and hypotension. Now we'll be learning about the physiological basis of each of these symptoms. Okay, so first, why is there a rapid thready pulse? So now when such a question comes, you have to write about the baroreceptor reflex. So let's see what happens. Main problem in shock is there's a decreased BP. So because of the decrease in BP, there is less stimulation of the baroreceptors, and the baroreceptors are aortic arch and carotid sinus. And because of this, there is less impulse through ninth, ninth and 10th cranial nerves. Okay, and this causes less activation of nucleus tractus solitarius. Okay, now what does this cause? Now there is less stimulation of CVLM and IVLM, and here there is less stimulation of nucleus ambiguous, and dorsal motor neuron of vagus. Okay, hope that is clear. Now less stimulation of CVLM and IVLM causes less inhibition of RVLM. Okay, and this results in increased sympathetic discharge. Okay, and this causes the less stimulation of NA and dorsal motor nucleus of vagus causes decreased pathetic discharge. Okay, now the decrease in parasympathetic discharge is on heart, the effect is on heart, and sympathetic is on three levels: on heart, on blood vessel, and on adrenal medulla. Okay, now on heart. So in heart there is increased heart rate, increased contractility, and increased stroke volume. In blood vessels it's basically constriction. So there is arteries and veins, and in veins, because of the constriction, there is increase in venous return, and therefore increase in stroke volume. Now in arteries, what does happen? There is increase in peripheral resistance. Now in adrenal medulla, what happens? There is increased epinephrine release, and this epinephrine increases heart rate. Now in heart, because of the decreased parasympathetic discharge, there is increased heart rate. Okay, hope that's clear. Now the final output of all of this is that there is an increased cardiac output, and also therefore the body tries a compensatory mechanism to increase in BP. So our main point here is there's rapid thready pulse. And why is that so? So rapid thready pulse, rapid, that means there's tachycardia. So tachycardia is caused by increase in heart rate, which you can see here. There's increase in heart rate, and thready pulse because of hypovolemia, which is the volume was very less. So because of that implies by thready. Okay, so thready means there's a decrease in volume. So I hope you understood the baroreceptor reflex, and if there's a question, you have to draw this entire flowchart as well as the diagram. Okay, hope it is clear. Now next we are going into why is there a cold clammy skin. Okay, so cold clammy skin, as we already discussed, what is the main problem? There's a decrease in BP. Now because of decrease in BP, there is increased sympathetic discharge. Now because of increased sympathetic discharge, there is vasoconstriction. So vasoconstriction, it's mainly seen in skin, skeletal muscles, renal vessels. So when there's vasoconstriction in the periphery, there's increased pumping of blood to the vital organs, and that is the purpose, to increase the pumping of blood into the vital organs. So your peripheral area or your extremities will be cold. So this is the physiological basis for cold clammy skin. Next, increased respiratory rate. Now here, when they ask about increased respiratory rate, you have to write up the chemoreceptor reflex. Now what is this reflex? So what is the main problem? Again, here there's a decrease in BP. Now because of decrease in BP, there is hypoxia, there is hypercapnia, and acidosis. Now because of all of these, this, what does it do? It stimulates the two chemoreceptors, which is aortic body and carotid body. Don't confuse this with aortic. Don't confuse this with aortic arch and carotid sinus, which is in baroreceptor. This is chemoreceptor. So this is aortic body and carotid arch. Never get it confused. Okay, and this, because of the stimulation of the chemoreceptors, what happens? This stimulation of the respiratory center and vasomotor center, and this causes increased respiratory rate. Okay, hope this is clear. Next, why is there restlessness? So from the starting point, so there is decrease in BP. Now what does decrease in BP cause? There's increased sympathetic discharge. And there is increased catecholamine secretion, which we have already discussed as increased epinephrine from adrenal medulla. Now, more than this, there's an increased stimulation of reticular activating system, reticular activating system in brain, and that is why there is restlessness. Hope this is clear. Next, why is there an increased thirst? And here comes, and when they ask about increased thirst, RAS mechanism. Okay, so there is decrease in BP, right? So because of decrease in BP, renin is secreted from JG cells, and this causes angiotensin 1 release by angiotensino from angiotensinogen. Okay, now angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme. Now, angiotensin 2 has many actions, so we'll be discussing about those actions. First is it is a potent vasoconstrictor. Okay, then it absorbs sodium from PCT. It stimulates aldosterone secretion. Then it evokes thirst. And finally, there is ADH release. It stimulates ADH release. Okay. So what does aldosterone secretion cause? It increases sodium and water absorption, reabsorption from distal parts of the nephron, right? So from the distal parts of the nephron, there's increased sodium and water reabsorption. Okay. Now, what does this cause? There's an increase in ECF or blood volume. Okay. Okay. Now, the ADH release also increases blood volume. Thirst also causes increase in blood volume, and absorption of sodium from PCT also causes increase in blood volume. And what does blood volume cause? Increase in blood volume cause, there is increase in BP. Okay, so there is increase in BP, and the potent vasoconstrictor action of angiotensin 2 also increases the BP. So this is the flow chart you should remember when they ask about RAS mechanism. Okay, now why hypotension? The entire discussion revolved around this, as in due to decrease in BP, due to decrease in BP. Now we are learning why there is hypotension. So it's a hypovolemic shock. So because of hypovolemic shock, there's decrease in blood volume. So obviously when the blood volume decreases, the blood pressure will decrease. Okay, and because of the decreased blood pressure, there's hypotension, there's decrease in cardiac output, and rest we have already discussed. Okay, so this is all about physiological basis. So when we tell about physiological basis, the three main mechanisms we learned were baroreceptor reflex, chemoreceptor reflex, and RAS mechanisms were the main important mechanisms. But we also discussed about the physiological basis of other signs and symptoms also. Okay, hope this is clear for you. It's very important. They usually ask this for questions. Okay, now next we are going to learn about compensatory mechanism, most of which we have already covered. So the compensatory mechanism, okay, it is divided into short term, intermediate, long term. Okay, short term includes baroreceptor reflex, chemoreceptor reflex, CNS ischemic response, release of catecholamines. In this we have already discussed baroreceptor, chemoreceptor, and catecholamine release. Now we have to discuss CNS ischemic response later. So when does the baroreceptor reflex come into action? When the mean arterial pressure is between 50 and 180 mmHg. It's very important. You should remember these values. Okay, and chemoreceptor reflex when it's less than 80, and CNS ischemic response when it's less than 50. Okay, hope it is clear. Now, intermediate ones are reverse stress relaxation mechanism, capillary fluid shift mechanism, renin-angiotensin vasoconstrictor mechanism. Here we have already talked about the RAS mechanism. In that we discussed that angiotensin 2 has a potent vasoconstrictor effect, and the vasoconstrictor effect causes increased BP. So we've already discussed that. And in long term, there is ADH release, RAS and other mechanisms. In that we have discussed, in ADH release there's increased water reabsorption. So we already discussed it. Next we are mainly going to discuss about CNS ischemic response, reverse stress relaxation mechanism, capillary fluid shift mechanism. Okay, but if in case a question comes as in what are the compensatory mechanisms, you have to write about all of this once again in detail. You have to draw the picture diagrams for baroreceptor reflex, chemoreceptor reflex, all of that you have to write it once again. Okay, even if they ask the biological basis, you have to write it once again. Okay, so I mean, we have to draw the diagrams mainly. Okay, so hope you understood that. Now we'll move into the details. So CNS ischemic response. So what is CNS ischemic response? It is also called as last ditch mechanism. Okay, so there is a decrease in blood volume. Okay, there's a decrease in blood volume to the vasomotor center. And what does this cause? So obviously there will be an increase in carbon dioxide and lactic acid accumulation. Okay, and this accumulation in fact it stimulates the vasomotor center. Okay, and this causes again sympathetic stimulation, and this sympathetic stimulation causes vasoconstriction. Okay, so this is the basic flow chart you have to know. Decrease in blood volume to vasomotor center, carbon dioxide and lactic acid accumulation, it stimulates the VMC, the sympathetic discharge once again or sympathetic stimulation, and there's vasoconstriction. Very simple. Okay, now reverse stress relaxation. Okay, again here there is decrease in BP. So decrease in BP, there because of decrease in BP there's less stress on walls, and because of the less stress on walls there is adjustment in the vascular tone, and because of the adjustment in the vascular tone there's tightening of blood vessels. Okay, so there's tightening of blood vessels. So this is the basic mechanism, you just have to know about this. Okay, so next is capillary fluid shift mechanism. So suppose this is your capillary. Okay, and blood is flowing through this, and this is your interstitium. Okay, so now because of decrease in BP or there's a decrease in blood volume, what happens? Hydrostatic pressure decreases, and because of decrease in hydrostatic pressure, what happens? Fluid from the interstitium enters the capillary. So fluid from the interstitium enters the capillary. That's it. That's all about capillary fluid shift mechanism. Hope that's clear. Okay, so this is basically we've discussed about CNS ischemic response. Okay, which is also called the last ditch mechanism. And when does it come into action? When the pressure is less than 50. Then we've discussed about reverse stress relaxation and capillary fluid shift mechanism. Hope this is clear, and you have no doubts in it. Next we come to stages of shock. So stages of shock, it is divided into three: non-progressive, progressive, and irreversible or refractory shock. So in non-progressive, so non-progressive shock is or non-progressive stage is also called as compensated shock. Why is it called compensated shock? Because this is the stage when the compensatory mechanisms come into action, and about 10% of the blood volume is lost, and there's no significant changes seen or effect. Only that the compensatory mechanisms come into action, which we already discussed. Okay, now the progressive stage, in this 15 to 20% of the blood volume is lost, and this is the stage where there should be a therapeutic intervention, or else it will progress into refractory shock. So here there is a vicious cycle of positive feedback mechanisms, and this causes a decrease in cardiac output. And the positive feedback mechanism include cardiac failure, vasomotor failure, peripheral circulatory failure, cardiac depression, and that is caused due to endotoxin. And finally this everything will result in multiple organ failure. So until unless there's a therapeutic intervention, there won't be an improvement in the uh, stage. Next is irreversible or refractory shock. Here there's no point whatever therapeutic intervention you do, the possibilities of dying within few minutes or hours is more. Okay, that's all about irreversible or refractory shock. Next is about treatment, which is the last topic. So in treatment, the general measures. So here they're saying um, patient kept in cold room. Why is the patient kept in cold room? So usually when the patient says that the patient is feeling cold, or you feel the cold extremities of patient, what is a natural tendency? To cover the patient with a blanket. But that you must not do, especially with hypovolemic shock. You must never cover a patient with a blanket if they come with shock. Why is it? Because when you cover the patient with a blanket, they feel warm, they start sweating, and this causes vasodilation, and there is even more fluid loss. So it just worsens the stage. Okay. Then is the Tredelenburg position. So in Tredelenburg position, what happens is, you raise the patient's leg by 612. Okay, so that's this. So this increases the blood flow towards the heart. Okay, so that's all about the general measures. Now, replacement therapy. This replacement therapy is usually used for hypovolemia, and it is when uh, yeah, we use it for hypovolemia. So suppose if it's hemorrhagic shock, there's a whole blood transfusion. If it's dehydration, lactated ringer solution is given. There's burns, plasma infusion is given, and plasma substitute is dextran. Next is sympathomimetic drug. So this is usually used for neurogenic and anaphylactic, and it's not of much use in hypovolemic. So the drug of choice is dopamine, and other drugs include adrenaline. And other therapies are oxygen therapy, glucocorticoid therapy, antibiotics, and digitalis. So this is all about shock. So it's kind of large and you might be exhausted, but these are the most important topics here. So we've discussed about the definition. We've told the main points are decreased cardiac output, inadequate tissue perfusion, and cellular hypoxia. We divided shock into four. That's classification: hypovolemia, hypovolemic, distributive, cardiogenic, and obstructive. In hypovolemic, we discussed the causes, that because of low blood volume, it's called cold shock. We discussed the causes. In distributive, we told it is warm shock. There's marked vasodilation, and it is again divided into neurogenic, anaphylactic, and septic. In cardiogenic shock, we discussed there is decreased pumping ability. It's also caused congested shock. In obstructive, we told there's an extra cardiac or external pressure which decreases ventricular filling. Then we told about the physiological basis. In rapid threaded pulse, we told there is baroreceptor reflex, and because of the baroreceptor reflex, there's finally increase in sympathetic and decrease in parasympathetic, and because of that there's increased heart rate, increased, the body tries to increase the bp, uh, and that's the compensatory mechanism. So we understood why it's called rapid thready pulse. It's because of tachycardia. It is because of tachycardia. Okay. Then we discussed why there is cold, uh, clammy skin. Then we discuss why there is increased respiratory rate. Here we discuss about chemoreceptor reflex. Then why there is restlessness, increased thirst, and we discuss about the RAS mechanism, and this flowchart is really important. Okay. Then why there is hypotension. Then the compensatory mechanism. This is very important, and this you also study within regulation of BP. So this also comes under regulation of BP. So we learned the short-term, intermediate, and long-term compensatory mechanisms. We discussed the mechanisms in detail, and then we came to the stages of shock: non-progressive, progressive, irreversible, or refractory, and then we came into the treatment. Hope this essay question is understood. It is a really important essay question, and hope you all can write really well for your exam. All the best for your university exams. Thank you.